Hi, everyone. Thanks for joining us today for our webinar, Automation in Healthcare, a Patient-Centered Approach. My name is Colin Tubner, and I'm the head of the Customer Solutions Department at airSlate, which is responsible for helping prospects evaluate our products and also helping them get up and running successfully with the products. And with me, I have Christian Parkerana, who is going to run a demo for us a little bit later on. He's one of our senior solution architects at airSlate, and he's great at helping customers understand our products. So here's what we'll go over today briefly, really just what healthcare automation is, how to look at the workflow needs for your organization, how to maintain HIPAA compliance in the processes that you automate, and also then, as I mentioned, we'll see a live demo of the patient intake process and some time for Q&A. And we'll look at all of this kind of through the lens of how you can address some of these problems with airSlate, which is our no-code workflow automation solution. So what is workflow automation? It's really about streamlining workflows that involve today often paper forms, manual data input, scheduling appointments, preparing consent forms, transferring data between systems, and then also storing, sorting, and retrieving completed documents. And so, all of these things together are often done very manually. They can be time-consuming and also prone to error. So with that, let's do a brief survey question. So the question is, and hopefully you should be seeing this in your webinar screen, do you know which healthcare processes can be automated? Do you have a sense for, in your organization, which processes are good to be, or are good for being automated? We'll give everybody a minute to respond to that. Okay, it looks like the results on this are mixed. So, we have some people have a sense for which ones can be automated, some don't. And so, we'll talk more in this webinar about what some of the best targets are for automation in healthcare. There's a lot of different options, and sometimes people get a little overwhelmed as to just how many options there are. So the overarching advice, if you really remember one thing, is you just have to pick somewhere. Typically, the benefits of automation are pretty large, and so you don't have to find the perfect target for automation to start with. You just have to find one that's good enough. Okay, so back to the slides. So how does automation help healthcare services? The biggest thing I think is just streamlining, or that's where people mostly focus, and so making the data collection easier, and then resulting in less time spent on paperwork. These kinds of manual tasks, really across all industries, not even just in healthcare, they're tedious and they don't add a lot of value for the patients or for customers in other industries as well. So if your workers can be freed up to spend more time on patient care or even like patient customer service, that provides an enhanced patient experience. The other thing, which is on this list, that leads to that enhanced patient experience is reduced error rates. And errors in paperwork, errors in billing, insurance, things like that really create a lot of problems for the patients. So with that, we'll jump to the next survey question. So the question is, do you know how automation improves healthcare services? And I gave some items already, but do you have a sense for how automation would improve your services and your practice if you were to start automating things today? Give everybody one more second to put in their votes. So as with the last question, a little bit of a mixed response to this one. About 2/3 of people thought that they have a good sense for how automation can improve healthcare. In fact, we see across all industries that automation is a huge priority for business executives today. There's multiple things driving that. I think a big part is that tools like airSlate, which allow you to automate with no code, have made it just that much easier and more reliable and cheaper to automate things. Another part is the labor shortage that we're hearing so much about, at least in the United States. You know, post-pandemic, a lot of people are not going back to the same jobs they had before, and so the ability to automate some of those things instead of being able to find non-existent labor to do them is really important. All right, so we'll give people a sense for the versions of a manual and an automated medical workflow here. So the manual idea, this is from appointment scheduling. The idea is that, even if you're using email or something like that to cancel appointments, even if you have an online appointment scheduling system, when you get cancellations, the admin is in the loop. The admin has to notify other systems about the appointment cancellation after getting the email, has to go notify other patients that might be on a wait list about an opening that came up, wait for somebody to request it, and then go schedule that new appointment with the new person. With an automated flow, you have really a different path where, after the cancellation comes in, everybody on the wait list might automatically be notified of the opening, and they get a link, and whoever clicks it first come, first serve, is automatically slotted into that new appointment. So from here, we'll jump to our last survey question. And I think this is, maybe my favorite of the questions. How much time do you spend on routine tasks and paperwork per week? And of course, this is going to be dependent somewhat on the types of people and roles that we have in our webinar today. But whatever it is that your role is, you can answer based on how much of your work is kind of routine and paperwork versus value add. We'll give people a moment to respond to this one. All right, good spread on this one as well. And of course, some of the people here may just not have routine tasks and paperwork as part of their job, depending on what role you have and what brought you to our webinar today. But we still have a good half of this audience that's spending at least 11 hours per week on paperwork, or 25% of their job, and some that are spending closer to almost half their job on paperwork. And so, the opportunities for automation, even if you can just attack some of that paperwork and some of those routine tasks, you immediately free up a lot of time for your workforce. And again, I mentioned this earlier, but that leaves aside the ability to reduce error rates, which creates other benefits in terms of billing, patient experience, and even potentially patient care, depending on what kinds of errors we're talking about. So how to assess the workflow automation needs of your organization? And I mentioned earlier that this can be overwhelming for people. It may seem like there's so many things you could automate. It's hard to know which one is the best place to start. But some of the things you can look at are, what's the most time consuming? What would be the biggest win if you tackle something? Which ones are of the highest priority or have the biggest impact on the patient experience? And again, that would be really looking at things where you make errors. Is there manual data entry that leads to errors in data entry, where if you have an automated system that's just copying the data from one place to another, you avoid those errors. And also, which processes are the most expensive to carry out? So it might be like if you have higher priced resources or more scarce resources that have to work on a particular task. For example, if the providers have to do a particular task and you can automate that, that might be higher value than automating something that clerical workers are doing. So how to choose? There's a couple of different characteristics that you really have to consider when choosing how to work with an automation solution. And I'll add one to this list of 4 as well here. So HIPAA compliance, of course, HIPAA compliance looms large over really everything that's done with respect to data and documents in the medical field in the US. And many other countries have equivalent regulations if you're not in the US. Easy learning curve. So unless you have a really big IT department and they're ready to write a bunch of code for you, you need a solution that your existing resources can work with. So automation, broadly, the concept of automation is nothing new. There's been mainframes in banks since the 1970s, and healthcare has by and large moved to electronic medical records with giant systems like Epic. But if you do have one of those, I'm willing to bet that you are not super comfortable customizing your EMR, EHR system to do the automations or to improve the patient experience yourself. You have to go pay Epic to do it, and it costs an exorbitant amount of money. A no-code solution like airSlate allows a much wider audience of people to create automations themselves for smaller tasks, maybe surround the EHR or surround scheduling systems or other pieces of the technology. Integrations, and so I just mentioned a couple of different systems that may be in your practice, and being able to tie into those with automation is vital. Otherwise you've got just another place that you have to manually enter data in, and another way that you could be getting errors as data makes its way into the system. And then finally, high ROI, which is it's a combination of kind of the easy learning curve and a low upfront cost for the software. So the things that can crush the ROI of an automation project are, does the software I need to back it cost $10 million? Well, then you got to find $10 million plus of benefit. And then also maybe you buy software and then some company wants another $10 million to implement it for you. So either way, if you have those kinds of constraints, then only really massive projects are going to be worth it. We think, again, by using the existing people in your business and providing no-code software, you can go automate relatively small projects and get a really high ROI from those projects. And the last thing that I'll add to this is support for documents. A lot of practices have been working with familiar documents for a long time. They don't want to change off of those. And airSlate has a very document-centric approach to automation that allows you to use some of your existing documents as the basis and still make those electronic, make them accessible on mobile devices, automate them as they pass from person to person, and take the data off the document and place it into systems via integrations. So how do we do healthcare automation in a HIPAA compliant way? There's a variety of PHI, of course, that you're dealing with in your practice, and we enable our customers to build HIPAA compliant automations. So you can design processes that protect PHI. airSlate ourselves, we can't access the information that's in these documents as it goes through our servers. And we also use encryption that meets the standards set by HIPAA, both for the documents in transit and when they're at rest on our servers. Another really important part is the audit trail. And so we keep a detailed audit trail of everything that happens in the process. And so you can see who's acted on it and when. Now, I will say one thing about this. HIPAA compliance is still ultimately the responsibility of the customer, right? And so while we say it's definitely easy and quite possible to create airSlate automations that are HIPAA compliant, it is also possible to create airSlate automations that are not HIPAA compliant. And this is really going to be true of any automation system because you can, there's really nothing stopping you from taking the documents that your patients filled out and then setting up an automation that emails them to the New York Times. That's possible in our system, as it is in most automation systems. And so you have to be careful how you set up the documents, but it's really common sense kind of things. And you are backed by the security, the privacy, and the encryption of the airSlate platform that's built right in. So a lot of the things, the elements of HIPAA compliance, you don't need to specifically worry about. We do sign a BAA with clients who operate in the healthcare field. So that's also a sort of required prerequisite for getting into HIPAA compliant workflows. All right, so at this point, I'm going to hand it over to Christian, who's going to give us a demo of airSlate in the context of a patient intake workflow.
screen real quick. All right. Can you guys go ahead and see that? Are you able to see that, Colin? Sorry, I wasn't. Okay, great. Awesome. All right. So in this particular use case, what we have is we wanted to go ahead and show you guys a patient going into a doctor's office. And in this case, using a QR code on their mobile device to go ahead and fill out the medical intake form. And so what happens in this case is that the patient will fill it out using their own mobile device, and we will take that data and we will go ahead and create a record in the doctor's office's CRM. In this case, it's going to be Salesforce. So we'll show how that is easily done. So for this particular demo, we'll use a web link, but I'll show you how that QR code looks. So we'll go ahead and go and end this here and show you what that looks like. So here are the options for the actual web link, but here's what the QR code looks like. This is what you would embed, print it out, put it at the doctor's office. Patient comes in, uses their mobile device, scans it, fills up their patient intake form. If it's an existing patient, we'll go ahead and update an existing record inside the CRM. If it's new, we'll go ahead and create a new record. We'll also take the actual final form that they filled out and attach it to that record. So we'll show you guys how that looks right now. All right, so let me go ahead and show you guys that. And so this is the patient receiving the form or scanning it, and then the intake form opens up, and then they're going to start filling it out here. So we'll just go ahead and add and fill it out. And then the whole point is that we're going to have it go into Salesforce, create that record, and at that point, attach the final form to the Salesforce record. And you can obviously, when it comes down to the information that you're asking within the intake, for this demo, we're not going to go through the whole form, but obviously there's a lot of information data that you can go ahead and take that from the form and then push it into like a CRM like Salesforce and update the record inside there or create a new record or whatever. But you know, this is a pretty long form asking a lot of, you know, medical questions. So what we're going to do today is just kind of show you just a couple things. And we'll go ahead and hit complete. So now that we hit complete, the whole point is that we should be able to see this record come into that Salesforce contact. And then when we open that record in the Salesforce contact, we should then be able to see the attached PDF of the person's name, their first and last name, and what that PDF is been renamed to. So let's hit complete. We're going to go ahead and close this out. Let me go ahead and reshare my screen and show you guys now what that looks like. So we're going to go into our contacts inside of Salesforce. We'll hit the refresh. And we'll see Bugs Bunny popped up over here. Let's go ahead and open up the record. And let's look at the details. So we gathered the person's name, we gathered their email, their birth date, their gender, material status, place of birth, mailing address, all the things that we had set up in our airSlate flow in our bots to go ahead and grab that data and push it into Salesforce. And then the final document, we can also see here that we've taken the person's name and attach that final form into the Salesforce record as well. So this helps eliminate patients going into doctor's offices and having to, grab forms or paper or fill out their intake there. This is a quicker way, a more efficient way, more, safer way from the day that we're living in today, to be able to do something like this. All right, and I'm going to go ahead and stop sharing. Colin, I'll turn it back to you.
I'm going to ensure that I can still see the chat for questions. I'm not going to go back to the sharing of the slide that says Q&A. But please go ahead and put your questions in the chat, and we'll do our best to answer them. I answered a couple by text already, but I will kind of reiterate those for the audience. So first, Anna asked, is it possible to automate patient billing and payment? How much time does implementation require? So those really two questions. Patient billing is definitely something you can automate, and in fact, airSlate can also be even set up to take credit cards. So I think that would probably depend a little bit on your posture versus insurance companies, whether you take insurance or not, and how you wanted to do that. But you could certainly do some portions of the patient billing in airSlate. As far as how much time does implementation require using no code, it really depends on what you're trying to do. I think that there are processes you can set up in just a few hours. Some of the longer projects that Christian and I have seen take a few weeks, maybe a month. And that would be, a heavier document generation process where you have lots of templates of letters that are nicely formatted or contracts, stuff like that. So it really depends. It varies quite a bit, but it's not 6 months or a year. It's usually measured in a few weeks. So we're also asked about what you need to do to remain HIPAA compliant, because I had mentioned something about being careful about the bots. So it's the bots are absolutely HIPAA compliant on their own. The key is that you not, for example, email PHI to the wrong person. And so, the bot doesn't know whether what you're emailing is PHI or not. And so you have to, or for that matter, whether the person who's receiving it is entitled to receive it. So you do have to make sure just that you're thinking about your process and thinking about HIPAA and PHI as you configure bots. But there's nothing that breaks HIPAA compliance on its own about using bots. And so, you should absolutely still use bots in HIPAA compliant processes. And then there was a question about, we're talking about airSlate to Salesforce to EHR. We absolutely have bots for many different systems. Salesforce is kind of meant here just as a stand-in, since it's familiar and Christian had it handy, as an example of a target system. We have bots for many different systems, and we can add them for any system that has an open API quite easily. So if you've got an EHR that you want us to connect to, it's something that you can talk to our sales team about, and often, and we've done this many times before, we'll add bots to the system in a matter of weeks that allow you to connect to the your target integration of choice, not just EHR, but many other. We have another question. We don't need any software once we do airSlate. I wouldn't say that. airSlate often acts as the glue between many of your existing systems. A lot often, and again, not just in healthcare, but really any kind of business, you have a variety of different systems that were all bought over the years with very good reason, but they very rarely do every single thing that you need done. And so some things are on paper, some things are in spreadsheets maybe, there's things going back and forth over email. And also your patients or other external people that you interact with don't have access to your internal systems. Christian's example of Salesforce is a good one. You're not going to give a third-party access to a system like Salesforce, or often they don't have access directly to the EHR. And so airSlate can be a way to build some user interface and some forms where those external people can interact with the data, update the data, provide data, and then it goes into existing systems. So it doesn't typically replace existing software that you have. It may save you the need to buy multiple other software packages because we have both workflow and document generation and the ability to collect payments and the ability to collect e-signatures. And so, and also the integrations, mind you, and that's a huge part of it. And so, having all of those things in one package might mean that you don't need to buy 3 different tools. You can just buy airSlate. But again, we're not going to get rid of your existing software packages that are holding patient data. So those are some great questions, and hopefully, the answers covered those. If there's any more questions, please go ahead and pop those in the chat, and we'll get them answered. And Christian, we did have a written question about the intake form. Do you want to talk a little bit more about where that intake form came from?
In one of our libraries, so it is a template inside of airSlate. So I use the web form. When you use a web form, there's a search, and you can search for many different forms that we already have built out for you guys. And that was one of them that was built out. So it was pretty easy for me to set up. Went in there, chose that template, and I can modify that template and kind of make it a little bit more customizable. But was pretty straightforward, adding my logos and things like that to it as well. But yeah, we have that in our airSlate library in our web forms.
Yes, and so just to kind of directly answer the question, which was about where did that form come from and what tool is it in. The form came from airSlate's library, and the tool used to edit it is part of airSlate. It's the HTML form builder. Great, so there's no more questions, so I think we'll go ahead and wrap up at this point. Please feel free to reach out to me or Christian if you have any questions in the future. You can use the contact sales, or there will be follow-up information sent to you after the webinar. And thanks, everybody.